Yay! I'm so happy. You guys, I've been talking to no one for several minutes now. So thank you so much for joining me. You really missed a lot of the exciting chat that I had all by myself. Hello, hi. It is so good to see you. I'm going to go ahead and just get ready for my presentation now. So I was actually just chatting to myself about screening my family for celiac disease, but I'm glad that I am on and I finally have everyone in the live chat. So thank you so much for coming today. Let's do a second round of introductions. So normally I am live at this Nourish Festival and I can talk to you and I can see your faces, and usually I do the whole, all right, who here is celiac? Who here is non-celiac, gluten sensitive? Who is a friend or family member supporting? If you want to leave that in the chat, so I actually know that there are real humans watching this, please let me know. It usually helps me give a good idea for whatever I'm talking about today. So you may know me as Erica from Celiac and the Beast. That's typically who I am out and about on the show circuit. I'm at Nourish festivals, I'm out at blogger conferences, and I am usually doing some sort of live streaming from my Instagram, possibly with the cat. So again, Erica with Celiac and the Beast, but I am here wearing my second hat as the lead of patient and customer engagement at I'm Aware. So we're an at-home testing company that uses serology, which is blood test, for lots of different health tests, but we actually started with celiac disease screening tests. We launched with Beyond Celiac as one of the nonprofit partners, and I was actually a beta tester, just little old me, before I decided to join the company full time. So as a beta tester of this product, it's near and dear to my heart because my mother actually could not get tested for celiac disease with her doctor, which is shenanigans is really the best way to put it, because as a celiac, you have genetic predisposition to have celiac disease in your family, and we'll talk about this a lot, so don't worry. And if I go fast, I tend to be a fast talker. Sorry, but this presentation will be live for 6 months. Hopefully you can just skip over all the technical difficulties that we had earlier. And if you just see me on the phone chatting about my cat, then you can see that that was the technical difficulties that we had before. But it's around for 6 months. So if you want to have your friends or family come. Oh, okay. So let's talk about how serious celiac disease is. I'm seeing a lot of people in the comments talk about how they have celiac. So I'm hoping that a lot of you are getting your family and your first degree relatives especially screened for celiac. As you may know, celiac disease is a genetically predisposed autoimmune condition, which means that you got to get from your mom or dad, right? So genes will come down from the family, and we are just special people because almost 30 to 40% of the general population have this gene, HLA-DQ2 and HLA-DQ8, from your family, but only a very small percentage will actually get celiac disease from it, which is bonkers. We're very, very lucky guys. But that is because we have some sort of environmental issue that comes about. And we'll talk about that in a second. So again, it's a genetic disease. We saw that it has to have an environmental component. You have to be actually eating gluten. So if someone were to have the genes and never ate a day of gluten in their life, perhaps they just really like rice, then they would never be exposed to this disease. So it affects about 1 in 100. A lot of people think that celiac disease is rare. It is not. If you look in a grocery store or a church, whenever we're allowed to go back to those things and you see over 100 people in there, chances are one of them, maybe you, will have celiac disease. So it's actually really common. People think that it's this rare disease, but as far as an autoimmune disease, it's pretty common. So it's not a food allergy. Like, let's get that straight. Not a food allergy. It's not an IgE allergy, which is what you think of when you think of kids with peanut allergies that go into anaphylactic shock. It is not a food sensitivity. Food sensitivity could be something that you work with your dietitian on an elimination diet about. It is actually a genetic autoimmune disease. I keep saying this because I want you to know that it's important to know that it's 1, genetic, and 2, autoimmune. which means it's serious. Your body is attacking itself. So your body is actually, when it eats gluten, it's causing this inflammatory effect in your small intestine. So this is always the part where I use my fingers. So if you've ever seen an Erica presentation, you know that I talk about the villi. So there's villi that's lining your small intestine. And these are the cool guys that absorb everything that you eat, like all the good nutrients and fats and all the good stuff that you get. So this is your body. And then when you have gluten as a celiac, it starts to degrade this villi until they get very blunted. And there's not a lot of surface area. This is a lot of surface area for all the villi to absorb all the nutrients in your body. But if it's blunted, it can't necessarily absorb as much. So you get nutritional deficiencies, you get a lot of other issues that will come along with celiac disease, and it can lead to something like intestinal lymphoma, all because your villi are blunted. So it's a very, very serious autoimmune disease because it affects all the nutrients in your body. That's why classical symptoms, we say classical because this is kind of what doctors thought celiac disease was in the 50s. They would see kids with these like very malnourished, bloated bellies. If you guys are old enough to know the Sally Struthers commercial about these third world countries where nobody could get nutrition and they all had these bloated bellies, that's what doctors thought was celiac disease. But nowadays, that's actually not the common presentation. The common presentation is someone like me that has non-classical symptoms. So classical is more of the, again, the bloated belly, the diarrhea. It's 8 a.m. Pacific time. Hopefully you're not eating breakfast because we're going to talk about diarrhea. We have like some clay stools or floaty stools or stools that don't look normal. Also weight loss, vomiting, all the things that you would think of as classical symptoms. But again, like I just said, that's not typically what we're seeing today in doctors' offices. We're seeing extraintestinal manifestations, which is just a big sciencey word to say there are symptoms outside of what's going on in your intestines. So if you're thinking about an aphthous ulcer or dental enamel defects, that's not in your intestine, but it's one of the signs and manifestations of celiac disease outside of your intestine, but it's all from this one autoimmune disease. And this is why it's hard to diagnose. Some say that there's over 300 symptoms of celiac disease. If you want to, you can share your symptoms in the questions. It could be interesting to see kind of what everyone has today. Feel free to get gross because I've already had breakfast. But lots of different things can be affected. And I want you guys to know, because it is important when we talk about diagnosing your family members, especially first degree, that your uncle, your mom, your dad, your brother, sister don't have to have diarrhea to be celiac. They could have something totally different. Let's talk a little bit about these weird things that could be celiac disease. Let's talk about skin. You've probably all heard of dermatitis herpetiformis, DH, the very, very itchy rash that you get sometimes on your elbows or your knees. That's a sign, a deadpan sign of celiac disease. Bones, osteopenia, osteoporosis. I had osteopenia at the ripe age of 25. That's not normal, you know? There's also all these things that can be caused by vitamin deficiencies as well. Iron deficiency anemia, for some, that's their only symptom. Do you imagine that's your only symptom of celiac disease? You have anemia, and then when you go on a gluten-free diet, it goes away. Other autoimmune diseases. So if your family has Sjogren's, rheumatoid arthritis, type 1 diabetes, these are all autoimmune diseases that are linked strongly to celiac. Nervous system, chronic fatigue, migraines, depression, ADHD, and also reproductive health. A lot of people don't think about infertility as a huge, huge symptom of celiac disease. So as you can tell, it's a really complicated disease. There's over 300 symptoms. It's a bunch of different things that you don't necessarily relate to a digestive health disease. And maybe that's why we're not getting our first degree relatives tested, because they may not have these symptoms that we think are related to celiac. Also, there's been some issues with celebrities using the gluten-free diet as kind of a fad diet. A few years ago, it was a big weight loss diet, which if I can show you my before or after pictures of before and after celiac, it is not a weight loss diet. In fact, many people gain weight on the gluten-free diet if you're celiac because you no longer have these nutritional deficiencies. And celiac disease food, our medically necessary gluten-free diet, is often filled with more fat and more calories and more sugar than our gluten-full counterparts. So it's not a weight loss diet. I don't know how it got to be a weight loss diet, but that could be part of why your family members aren't being tested, because they think that it's this faddish diet that isn't really a big deal, when in reality, it's a medically necessary diet for those with celiac disease. Okay, so we've seen that there are a lot of reasons why we need to be tested that are outside of just kind of the diarrhea or any other issues. There is clearly a serious risk. And let's talk a little bit about the genetics. Like I said, there are two genes, HLA-DQ2, HLA-DQ8. I am not a geneticist. The only reason why I know that is because I have been genetic tested for celiac disease. Some of you may have done the 23andMe test where you saw that there were genetics for celiac disease. I know that I got my parents tested for their genetics just because I was interested, because I'm a nerd like that. But it's all part of the human leukocyte antigen, which is all part of the autoimmune disease and immune system gene. So if you think about that gene, we're connected to that gene, which is why it's an autoimmune disease. But the important thing, if you forget all about genes, that's fine. Leave that to 23andMe or your geneticist or your doctor. Just know that there is a genetic increased risk for parents, siblings, and children. Those are all first-degree relatives. So second-degree relatives would be aunt, uncle, cousin, grandmother, grandfather, grandparents, grandchildren. So just talking about your first-degree relatives, your mom, your dad, your sister, your brother, your son, your daughter. These all have a 4 to 15% chance of developing celiac disease if they have, because they are genetically related to you who are diagnosed with celiac. Genetics is very difficult to understand. So there's no step like Mark. If you were my son, you'd have a 1 in 4 chance. That's not quite how it works, and it's especially difficult to know how it would work because, again, environment plays along with genetics. Again, you have to be exposed to gluten. A lot of people actually get celiac disease when they have surgery, when they were in a car accident, when they were pregnant, or after roto or norovirus, which is when you have, like, say you're at a buffet or on a cruise ship and you're eating food and people didn't wash their hands, the stomach flu, basically. That can trigger your system to cause celiac. Now, again, you have to have the genes. It's all kind of an environmental factor where everything has to be right at play, your genes, your environment, and suddenly you now have celiac disease. But again, like we said before, just because you have the genes, it does not mean that you necessarily have celiac disease. So my partner has the genes, but has been tested with serology and has no issues with gluten. So there is a small percentage of everyone with those genes, again, that have to have that right permutation of the environment and the genes to actually get celiac disease. So consider yourself lucky, because there had to be a very, very lucky factor for you to get those genes and the environment and have everything at play together. So if you have children and you're an adult with celiac disease, they can have the gene test. And if your kids carry your genes as well, they have all the right genetic pattern, they should be tested for serology every 2 to 3 years. That's how serious it is, right? You need to get your kids tested. And we'll talk about the option for I'm Aware and their at-home celiac disease screening test and celiac disease monitoring test at the end of this. So let's talk about why getting screened. It seems kind of obvious, but sometimes you have to just know the why. So catching celiac disease early, okay? You want to make sure that your mom, your dad, especially for kids, you want to catch this disease early before damage is done. Now, I was caught at 25 and I had osteopenia, which means that my bones were right on the way to get osteoporosis, the brittle bone disease, at 25. So imagine if I had delayed my diagnosis any longer. I could have been falling down and having a hip fracture at like 30, you know? So I think that it's easy for us to be like, I'll do it another year. I'll wait until my well woman exam or whatever to like ask to be screened for something, or I'll wait for my annual visit. But you guys, this is serious, and it needs to be screened as soon as you can to prevent long-term damage. Again, we don't want anyone to get intestinal lymphoma from this disease. That is what we want. Nobody should be dying. Nobody should be having long-term damage. But unfortunately, if you leave celiac, it can do some really bad things. Also, revealing celiac disease to those who may not have considered it. Again, if your mom's been like dealing with migraines for years, maybe she hasn't considered that it's diet. Maybe she thought it was like, oh, I took dairy out and I don't feel any better. Well, that's great, because maybe you have celiac disease. I mean, you gave this to me, maybe you have it as well. So there could be some uncovered celiac disease symptoms that you may not even know. So it won't be easy. I should have caveated this whole thing with, this is not going to be easy. If you've never tried to convince your family to be tested for celiac disease, it's no easy task, but you've got to. There are some internal barriers that these people are going to have to get over emotionally for themselves. Internal barriers are more like, why do I want to do this? This is stupid. I don't have any symptoms. I want to avoid knowing it. I just want to like go about my life as normal. And then there are some external symptoms. So symptoms outside of them. Say they want to be tested, but say they don't have the health literacy to know what kind of test to ask. Sometimes they don't have access to medical care, which is huge right now in our country. So there are barriers that you can help internally and also help them with some external barriers, which is why I'm aware kind of comes into the picture in at-home testing, which is why I'm such a super fan. I decided to join the company, right? So let's talk about these barriers. First, I'm going to take a water break because I've been talking a lot. So feel free to leave a question if you'd like. All right. Thanks for sticking around, guys. I know we had some technical issues, but now we're in the nitty-gritty. Let's talk about those barriers. So first one is an internal barrier that we've got to break down. Why should I be tested without the presence of symptoms? You know, and that's because celiac disease often flies under the radar. It's called the great mimicker. People think that they have anything from an allergy to IBS, and in reality, it's celiac disease. So people may think that they don't have any symptoms. I'm so sorry. Okay, so what I was saying is when I start a job, I tell them that a lot of times I run into walls. I run into everything. I trip, I fall, I'm very clumsy. I have poor proprioception, and I have no idea if this is caused by celiac. I've had it my whole life, but there's something called gluten ataxia. And if you constantly have problems with balance issues, you may want to check that out. It's a long-term damage that you can have, and your nerves are kind of firing strangely. So these are weird things that happen, right? When you have celiac disease. And again, that's something that nobody really quite understands. So if people are like, I'm constantly tired, or I have IBS all the time, maybe something to look into. So again, we're talking about the barriers of why should I be tested if I don't have symptoms. So some celiac symptoms that they may not know are symptoms that are important for you to bring up. And again, this is a great part for you to bring in your mom and your dad, or anything else that say, I don't have symptoms. So GERD, reflux. I mean, a ton of people are on medication for long-term for GERD and reflux. I had it too before I was diagnosed with celiac. I was on long-term medication, but I got off of it because I realized that GERD was a part of celiac disease. Iron deficiency anemia. Again, we talked about how the fact that iron deficiency anemia may be the only symptom that you have, which is bonkers, right? Dermatitis or pediformis, or any sort of itchy rashes, osteopenia, osteoporosis. Again, dental enamel issues. Who would have thought that a dentist can now diagnose celiac, or at least put you on the path to screening for dental enamel issues? But it's true. Y'all don't want to even see my teeth. True statement. So dental issues, aphthous ulcers is something that I get huge, huge ulcers that are inside your mouth, lining and the mucosal membrane. Huge, huge issue for those with celiac. And most people don't quite understand that that is due to celiac disease. Abnormal liver function tests. If you have friends or family that have like a weird abnormal liver function and no one can figure it out, could be celiac. Again, celiac disease could also affect the pancreas, things you have no idea about. Again, neurological conditions, so ADHD, seizures. I just talked about ataxia. That's a huge one. People think that they have MS. People think that they have MG, which is myasthenia gravis. I screw this up, and I'm so sorry to my friends that have MG. I screw it up every time. But people have this, and that may be due to celiac disease. Yep. non-epileptic seizure for celiac disease. Yes, exactly. I run into people that have had grand mal seizures because of celiac, and it's so crazy how it affects the nervous system. So again, these are symptoms that like people think are not related at all, which is why they don't get tested. They may have a million tests for something like that, but they don't understand that it's related to celiac disease. And something that Alice Bass says from Beyond Celiac, maybe you don't know how good you can feel until you've been tested for celiac and you know what it's like on the other side. Crazy, right? Families should also be tested if they have these conditions that are related to celiac disease genetically. So Down syndrome. So people with Down syndrome have a prevalence of celiac disease of 5 to 12%. So we often talk about, I know I'm aware, I wrote a blog, or I was part of a blog post that talks about Down syndrome and celiac disease related together. Turner syndrome, Williams syndrome, those aren't quite as prevalent as the prevalence of celiac disease as Down syndrome, IgA deficiency, type 1 diabetes, Sjogren's syndrome, and autoimmune thyroid disease. We're talking about hyperthyroid or hypothyroid, so very important for you to know. Another barrier, I don't want to know. I don't want to know. I don't want to know. That's a big one. I don't want to be gluten-free. So I'm sure that many of you have had relatives that are like, well, I don't even want to know because I don't want to eat gluten-free. Well, sorry. I mean, it's hard, right? Like I wouldn't want to be on this diet if I didn't need to be. Although in 2020, I can find anything that I want. Anything that I want whenever I want it, right? Like a croissant, found it. Donut, found it. Like things are a lot easier now than say, Erin from Gluten-Free Globetrotter, like when she was diagnosed in the 80s, or Beth Hilson diagnosed in the 50s. She couldn't find anything. And now we're very, very lucky. But still, like, I don't know if I would necessarily want to be on a medically necessary diet if I didn't need to be. So too bad, so sad, but it does get easier. And please, if this is the barrier to your family, I don't want to know, please tell them that you will be their support system. I know it's hard, but we've all gone through it. So why don't you pay it forward and be that support system to the next person? Next barrier, and I actually see this a lot. Why can't I just start avoiding gluten? I see this a lot with people who get diagnosed as well. No. You have to be tested for celiac disease. So why can't you just go gluten-free? So first of all, if you don't get tested, then you don't know you have celiac. You don't know how careful you need to be. I've seen people that don't know if they've been tested or not eat fries out of the shared fryer. If you saw Vanessa Weisbrod's presentation about shared toasters, or Gluten-Free Watchdog's presentation, or Gluten-Free Watchdog's recent post about shared fries and fryer, that's huge, you guys. You have to be very, very strict on a gluten-free diet. And unfortunately, people who are not diagnosed with celiac disease tend to not be as strict. It is scientifically proven. I do not remember what presentation it was at Digestive Disease Week, but it showed that people, unfortunately, who are not diagnosed aren't as particular about their diet, and you do need to be very strict, under 20 parts per million for food. They also, if you don't get diagnosed and you just go on your merry little way with a gluten-free diet, you are not necessarily getting the follow-up care that someone with celiac disease needs to have. So they need to have a DEXA scan. Again, I talked about osteopenia, osteoporosis, especially for women. It's so important to have a baseline DEXA scan. Please go out and do it. Tell America sent you. Scanning for nutritional deficiencies. So celiacs are notoriously low in several nutrients. I cannot remember them off the top of my head, but there's a great list on Beyond Celiac and Celiac Disease Foundation about nutritional deficiencies, and you need to be tested. Also, follow-up blood work and biopsies. So you need to have a biopsy 1 to 2 years after your first diagnosis to make sure that your histology, which is your little villi, and your tissue samples are getting better. Also, you need to have follow-up blood work, which is very important. And we'll talk about our celiac disease monitoring test, which I love from I'm Aware, that can help you with your long-term monitoring of your serological biomarkers, so your blood, right? And you also need to be followed up with for other autoimmune disease. I can't tell you, we've talked about how it's linked to so many other autoimmune diseases right now. So chances are, if you're not getting tested for celiac, you're not knowing if you have to get tested for other autoimmune diseases as well. Also, there is no need for someone to be on a very, very, very restrictive diet if they don't need to be. We can see that that leads to an increased risk of social isolation. I mean, just think about kids that have to eat by themselves and can't share food. Think about you at an office party when you can't necessarily eat what other people are eating. There's a risk of social isolation. Also, there's a risk of latent disordered eating. So you could have an eating disorder. This could also trigger as well. There's been studies about that. There's also been studies, sadly, about the decreased quality of life of those with celiac disease. I'm not saying that it's bad to be celiac, but it's hard. And there's actually been scientifically proven studies that show that it's harder for us. And I wouldn't want to put my family members through that if I didn't need to be. Okay, so also the biggest thing that you miss without a celiac disease diagnosis for your family is you could miss a very serious true diagnosis. If they're sick, like they have bowel issues and they just go gluten-free, you could be missing some major issues. You could be missing IBS, which there is medication for that as well, but IBD, inflammatory bowel disease, Crohn's colitis, microscopic colitis, often imitates celiac disease. That's something that needs to be dealt with true medication, not a diet. So you could be missing things that are very, very important. There's also other stomach issues that mimic celiac disease that you need to be aware of. H. pylori, again, IBS, IBD, drug-induced small bowel disease. There's a lot of issues that can mimic celiac. SIBO, that's a big one that people are talking about. Small intestinal bacterial overgrowth. There are so many things that could be wrong with you. It is so much better just to have a clear-cut diagnosis and not have to deal with, should I have taken a medication, et cetera, et cetera. So that's a barrier that we need to break down. Just be tested before you go gluten-free. A huge one, unfortunately, that we have to deal with is celiacs, and that they'll deal with is that they think celiac isn't that serious. And we've talked about it before. Again, it can lead to long-term issues. We're talking about fertility issues and miscarriages with women. We are talking about other additional autoimmune diseases and sadly, long-term, possibly even intestinal lymphoma and refractory celiac disease. Bad, bad, bad stuff, you guys. So it's very important to know that it is serious. Next, external barriers. Hold on for 1 second. So external barriers, like we said before, are the barriers that you have with, say, the medical system. And this is really where I'm aware at-home testing can shine. So an external barrier, something like, hate the doctor, I'm not going just for a blood test. He always makes me do weird things, I can't do it. Perhaps they're not health literate. Perhaps they don't know how to ask the doctor. For some people, it's really hard to ask the doctor something. They're very intimidated by it. Or they don't trust the doctor. They don't trust the medical system as a whole. Or they only go once a year and they refuse to do anything other than their annual test. So if you know someone like this, throw it in the comments. Because believe me, I cannot be the only one that has to deal with this. That's where I'm aware can come in for at-home testing. Seriously, you order it online. You can even order on Amazon. You go to imaware.health, you get the celiac disease screening test. We send it to you in the mail. It's 5 drops of blood. You send it back, and within 5 to 7 business days, you'll have an answer at least to be screened. So you don't have to go to the doctor. It's under $100, super easy to do. That brings us to the next external barrier, which is cost, and insurance won't cover it. Sadly, my mother had to deal with her doctor who was like, you don't have symptoms. I don't care if your daughter's celiac. Apparently he didn't quite understand it, but he was worried that insurance wouldn't cover it because her symptoms didn't necessarily match up to what he was thinking. So if they don't have classical symptoms, I think that's really hard for them to put in a diagnostic code and get tested. And it may be kind of exponentially it may be very costly to get blood work done outside of your doctor's office, which is again why imaware comes in with our at-home celiac disease testing. Is under $100. It's $99. We have a $10 off promo code at our booth. So we're making it super, super easy. Again, put them all in your stocking stuffers for Christmas. Get everyone tested. Another barrier is that my doctor said that I don't need it. And you know what, guys, I get this a lot. And it unfortunately is a lack of education on the doctor's part. And I love doctors. I love them so much. I obviously visit them a lot. I feel like I should get a frequent flyer card. But celiac disease as a whole is a very, very small part of their medical training. Unless you're getting a doctor who specializes in celiac disease, which we know are pretty rare to go to. I go to Mayo Clinic and they had a doctor that, I saw at every digestive disease week. It was very nice that she was very well informed. But you're going to a regular GI, they may be focused on liver, or they may be focused on IBD or IBS, and maybe they don't have everything up to date about celiac disease and getting first-degree relatives tested. So unfortunately, it may just be a lack of education. And we can't blame them. They've got a lot of things to think about. So you can tell them, you can educate them and tell them to go to the Beyond Celiac or the Celiac Disease Foundation website and learn more about that. They've even got a way for you to find doctors that are literate in celiac disease. But again, that's where I am so happy to be a part of I'm Aware, because we take the doctor out of it. We have a medical team that will approve of the requisition and also approve of your test results when they come in. I met with Dr. Guandolini, who is on our advisory board. I love him so much. He's so great. The University of Chicago Celiac Disease Center. We have that capacity. So if you have a doctor that may not understand what's going on with celiac disease, that's why I'm Aware comes in, because we know how to screen for celiac disease in the comfort of your own home. There's also another barrier that I talk a lot about that may not necessarily work for your first-degree family members, but you never know. If you are already diagnosed with celiac disease, we talked about this a little bit earlier, there is need for follow-up screening. So again, some doctors may not know the proper protocols, that there is a serology improvement within 6 to 12 months on a gluten-free diet. So I get a lot of readers on my blog that say, I set it and forget it. They just said, you have celiac disease, be on your merry little way. And they never tested me for anything else. They never did a follow-up biopsy. They never did follow-up blood work. So it's important for you to get your serology or blood
is on.
Oh, hello. I was just writing my dissertation while we were gone. I hope you enjoyed our little break. So we were just talking about having to be eating gluten for any sort of serology or biopsy. I know I disappeared. Hopefully I'm back and you guys can see me. We're talking about a very important fact. You have to be eating gluten to be tested for celiac disease. So you have to be eating gluten for the serology test and for a biopsy. So unfortunately, some first-degree relatives, again, may have just gone gluten-free. Again, that's a bad thing. We want them to continue to eat gluten until they have the serology, which is the blood test, and the biopsy. Okay, so for our monitoring tests, you can't be eating gluten, again, because we want you to be on a gluten-free diet. Once you're diagnosed with celiac, you have to follow a very, very strict gluten-free diet. But I'm Aware does offer a monitoring test for those that did not get follow-up blood work done at their doctor's office. Again, maybe the doctor just didn't know that you should do follow-up blood work at 6 to 12 months. Perhaps you're like, I can't go back to them. I don't like them. I had a GI that I didn't like, that I didn't want to go back to. We all have issues. So if you want, you can get a monitoring test for 6 or 12 months. You can even get them quarterly and just make sure that your serology is trending down, right? We want those numbers for TTG, IgA, and all of our different numbers that we test. I'll tell you about that in a second, to trend downward, right? You want to make sure that your blood is improving, that your serology is getting better over time. Same with your histology, remember the villi. So if you didn't get a follow-up biopsy after 2 years, that may have been something to talk to your GI about, but we want to see those villi healthy and thriving. Unfortunately, sometimes it does take a lot longer for your villi to improve, especially if you've been gluten-free for a very long time. Sometimes it takes 10 years to get your villi back to normal, but at least we want to see in that follow-up biopsy improvement in the villi. So that's why I'm Aware offers 2 different tests. So one is a screening test, right? If you've never been screened for celiac disease before, you need to be eating gluten. The second one's going to be a monitoring test, and that one you have to be gluten-free. And that's for you to see over time periods that your numbers are trending down. So our at-home tests, I get to do a little infomercial spiel right now. This is why I joined IMAware. This is why I'm such a big fan, because I am a fan of their celiac disease screening test, because I know that a lot of people have problems either getting themselves screened or getting their family member screened. I screened my own mother through this test. So if it's good enough for me, hopefully you will like it as well. Again, 5 to 7 business days, you'll have a result back, okay? So it is the gold standard of testing, same as like what they would test for any other GI's office, tissue transglutaminase antibody. It's TTG-IgA biomarkers. This is going to sound like a foreign language to many of you. We also do TTG-IgG, DGP-IgG, and DGP-IgA. Don't you worry. It is all on our website at imaware.health. You don't have to remember any of that. And also, we do offer the monitoring tests, which are the same biomarkers, but again, we'll present it in a graph so you can see it trending over time. So in summary, yes, it is almost time to go, and I know that we've had a lot of issues, so thank you so much for sticking around. In summary, regardless of any excuse, any questions that your first-degree relatives have, if you have celiac disease, you have to get your first-degree relatives screened. Please, I am begging you. It is very important for them to get screened. If you need help, IMAware can be a tool in your toolkit for less than $100. And again, we're on special for the Nourish Festival attendees for $10 off. For under $100 typically, you can see if you have elevated biomarkers, and that will take you on your celiac journey. So you can get a biopsy and actually get the gold standard diagnosis for celiac disease, or you can continue to have your serology monitored by IMAware. So if you want to learn more about IMAware, you can head to our booth at the Nourish Festival, or you can visit imaware.health. That's our website, and check out those tests. We also offer cardiovascular tests. It's really exciting. I went to go see a vascular specialist, and I learned all about plaque in the arteries and some really cool tests that we offer, as well as a genetic haptoglobin test, Lp(a), Lp(PLA2), very exciting cardiovascular tests. And I'm not a cardiology nerd. Clearly, I'm a celiac nerd. But I'm really excited about the other tests that we have available. Again, this is a company that I believe in. I got my own mother screened for celiac. So that is why I'm here today, begging you to get your first-degree relative screened. And with that, I will answer any questions. So if you want to pop a question in the questions, I think you see it as a chat or a question, or leave a comment. I will see if I can answer anything. If not, I will be on live afterwards so we can chat. If you have any questions about IMAware or questions about getting your first-degree relatives tested. So let's go through. Your mom is resisting. My mother also resisted. She is of the camp that she did not want to be tested because she doesn't want to go gluten-free. And this is a woman who has eaten all of my Thanksgivings for 12 years. And she's eaten my pies, and she's eaten my turkeys that I've made gluten-free. She's made her own turkeys gluten-free for Thanksgiving and for Christmas. So I get it. I understand. But I think there is a very serious issue. If you knew that your mom or your dad or your siblings or your children could live a happier, healthier life, wouldn't you want to give them that gift? And I think that that's kind of cheesy, but honestly, celiac is so serious that I think that that's something you need to approach them. I want you to live the longest, healthiest, happy life that you can. So yes, so age of testing, great question. With IMAware, because we are sold online, we are 18 and over. Very important. So if you do have children that need to be tested, they should see a pediatric gastroenterologist. I know there's a very few of them, but there's some great ones out there. So if you have children that want to be screened, please get them screened at a pediatric gastroenterologist or a gastroenterologist that specializes in pediatrics. Or if your pediatrician is awesome and totally knows about gluten-free, knows about celiac disease, they can also get a test as well. They'll have to probably get a venous blood draw for that as well, probably go to a lab, or if they have an in-house lab. So yeah, 6-month-old. And I would go to Beyond Celiac or Celiac Disease Foundation. They have actually a recommendation for what age you should start testing your children. And again, they could be also genetic tested as well, but it's just better to screen them because it's much easier to get just a simple blood test for a kid. So how long does one have to be eating gluten prior to testing? So they've changed their recommendations, and they changed it right when I was going back on my gluten challenge. So a gluten challenge is actually when you go back to eating a full gluten diet after you've been gluten-free for a long time. Again, unfortunately, you do have to be eating a gluten-full diet in order to be screened through serology or histology, so again, blood or a biopsy for celiac disease. So if you've gone gluten-free, or if your kids or your siblings or your parents, you do have to be eating gluten again. And have this be your like vacation away from gluten-free. It's always been 6 to 12 weeks. Unfortunately, 6 to 12 weeks of eating full gluten. They changed the weeks to now be 6 to 8, but 6 is really the minimum amount of weeks that you need to be eating gluten. Again, sadly, you do have to have some sort of histological, serological damage to happen to show that you're sick enough to have celiac. It's kind of weird, but you do have to be eating enough gluten to be sick enough to have it show on your blood work or your biopsy. So minimum 6 weeks. I think I was trying to do 12 at Mayo Clinic, and they're like, oh, you're too sick. You can't go more than 8. So I think I made it to 8 weeks. I don't know. I've done 2 gluten challenges, I think. It's been a long path. But yeah, so definitely go back on that. So yes, the age requirements again are 18 because we do sell tests online. But if you have someone that's under the age of 18, a pediatric gastroenterologist or your pediatrician can tell you where you can be screened for celiac disease if they can't do it themselves. Yes, so eating gluten before being tested, 6 to 12 weeks. So we say 6 to 8 weeks, which I think is the new requirement, is 6 to 8 weeks. So minimum of 6 weeks. And you want like a slice of bread a day, a muffin a day. I mean, if you want to go for it, go for it. You do have to be eating it for a minimum of 6 weeks. So what's your regular meal planning like? Oh, guys, I eat a lot. I eat a lot of carbs because I love gluten-free food. We have so many great gluten-free bakeries here. I am very lucky to have really, really great gluten-free food. I eat Purity Protocol oats for breakfast. Sometimes I make toast with my favorite gluten-free bread. For lunch, I may have a sandwich. Or there's actually a couple microwave food companies that have gluten-free food out there for dinner. I mean, I eat just like everyone else eats. My food just happens to be gluten-free. Okay, so last question. Why do a gluten challenge after a diagnosis? Okay, great. So you don't necessarily have to do a gluten challenge. If you've already been diagnosed, there's no need to do a gluten challenge unless they're suspicious of anything. But for me, I did the bad thing where I just went gluten-free without a real test of if I was celiac or not. And I really need to know because I was still sick and I was feeling weird and I had some other issues. So I had to do a gluten challenge where I went back on gluten for those amount of weeks. I just went crazy. I ate everything that I saw. It was great. I was so sick as a dog though, but I made it through and I got my gluten challenge. You have to get your system sick enough to have a reaction show in your blood work or your biopsy. So unfortunately, the gluten challenge is necessary if you've already been, you are screened and it's positive, then you would move forward with a biopsy, again, still eating gluten for the gold standard diagnosis. All right, okay, if you have any other questions, I can hop on a live chat at the I'm Aware booth. Please join me there, and hopefully you had a great presentation. I'm so sorry for all of the pauses or the frozen Ericas that you saw on the screen. Hopefully I looked okay during those. I couldn't see them, but hopefully you enjoyed it. And again, please find us at imaware.health. You can find me, Erica, at celiacandthebeast.com. Again, imaware.health is where you can look at the celiac disease screening test and the celiac disease monitoring test and all of our other at-home blood tests. So thank you so much for your presence here. Congratulations if you're in the future watching this. I hope the next 6 months are great. And yeah, I hope you have a fantastic day. Thank you for joining me at the Nourish Festival. And thank you so much for the Nourish Festival for having me. Thank you so much. And we will go bye-bye. I think I'm doing this right. Bye.